Welcome, everybody. Thanks all of you for joining. I'm Dr. Ken Zweig from Northern Virginia Family Practice, and I am very, very pleased to introduce a wonderful and very good friend of mine, Dr. Nicole McGarry, who is a therapist in the Northern Virginia area. Nicole went to school undergrad at Gonzaga University and then got her master's in psychotherapy at the University of Montana and has been practicing it in the McLean area since 2009. She is a fabulous therapist, child and adolescent therapist, mostly, does see some adults, mostly child and adolescents, and has a special focus in ADHD, which is why we invited her here tonight. So it is my absolute wonderful privilege to have Nicole join us tonight and present to all of you about ADHD. And before we get started, just so you know, if anybody has any questions, please put them in the chat box. See that at the bottom of your screen. You can put them in anytime you like, but we'll probably save them until the end and try to catch get all the questions as we can. Right? So without further ado, please take it away, Nicole.
Great. Thank you so much for inviting me. I love to do these talks and to speak more about ADHD, which is becoming a more common diagnosis for children in that I think people are finally recognizing the many facets of ADHD. People always knew that it involved focus and attention, and sometimes that led to difficulty in school. But what we're here to talk about tonight, and what brings most clients into my office, is the emotional regulation side of ADHD. So my aim is to help you be informed consumers about both treatment options and possible medication options, and to really understand the full profile of either your child's ADHD or of your ADHD if you're an adult here. And please do put any questions that you have in the chat, and Ken will get them to me as we go along. So we will jump into it. All right, so if it's ADHD, why is my child, or why am I, so emotionally impulsive, quick to temper or easily frustrated, moody, socially less mature, potentially rejected by my peers, and really stubborn and stuck, right? So these are some of the qualities that are on the emotional side, or the emotional regulation side of ADHD. So it's important to recognize that the brain has many areas of executive function. So if you show me a child or an adult with ADHD, I'll show you a bunch of different profiles that might be impacting that person, right? Some of you might have children, because there's such a strong genetic component to ADHD, where one child looks a very specific way and your second child looks totally different, and they both have ADHD. So having it broken down into different areas of executive functions that can potentially be impacted helps you begin to speak with your doctor or your treatment providers or your therapists about what are the areas that are of most concern for this particular client, for this particular child. First, and the one that's often recognized, is under activation, right? This is my ability to organize, to prioritize. Let's say I'm aware I have 5 things, but all of them are screaming important to me, and one of them might be just to throw the wrapper away, but it's as important as the homework assignment or history test that's happening tomorrow. So I can't prioritize, right, of that list what should get my most important effort. And then initiating, or just being able to start to approach something, especially if it's non-preferred and it's something that I'm not looking forward to, or it might make me feel insecure or less than, I might engage in a lot of avoidance behavior. I can't activate. Once I activate, I have trouble focusing, tuning in fully by eliminating or dimming outside noise, right? Whether that's the cat running through the room, or the light that's flickering, or what another kid is saying in class. It may also be I'm internally distracted. oh, I have that really big thing I have to do when I get home, and I'm not going to get enough time to rest or relax, right? So an internal, intrusive, distractive thought, right? So tuning in and focusing on the preferred and the thing I need to be doing, sustaining that focus for a long enough period of time, and then also being able to shift my focus or my attention from one thing to another, right? Henceforth, the huge emotional meltdown when I have to move from a preferred activity to a non-preferred activity. Effort, being able to regulate my alertness to put in just the right amount of energy without draining myself, right? For a certain amount of time, being able to sustain that effort, and then adjusting my processing speed based on what is needed in the situation. Emotions, of course, is managing frustration and modulating my emotion. Is the volume on it just way too high? Is it looking opposite where maybe I'm frozen? I'm having a huge emotion, but I'm like still and quiet, and I struggle to find my voice or say what I want to say in that moment. Emotions can look frozen as well. They're not always the hailstorm. All those kids get the most attention because they're screaming for it. So, but it can also look the opposite, where I'm very numb to what I feel. Memory, holding on to and working with information. Short-term memory is much more impacted. Long-term memory, not so much. But short-term working memory, if you give me 4 tasks to do, I'm probably going to get through the first 2 and lose my way and forget what the 3rd and 4th thing were that I was supposed to do. Retrieving memories. This also impacts emotion, and we'll talk about that later in terms of why, but holding on to past events and did stuff work out? How did it work out? How did I problem solve this last time? Right? That can really be involved here. And then action, monitoring and regulating your own behavior, right? This is more of that hyperactivity, motor quality. Like, can I quiet my body stimulus when I need to quiet it? So you can imagine, as we went through all of those possibilities, as you're looking at your own profile or your child's profile, there's many different areas where your child may be impacted and many areas where they may have strengths that we can utilize then when we're putting in proper behavioral interventions and we're thinking about possible medication intervention that might be appropriate for them. Okay, let's move on. All right. So ADHD is a neurologically based difficulty located in the frontal lobe or the prefrontal cortex. It is not laziness. It is not a lack of effort. It is not a knowledge problem. It does not involve intellect. It is a performance problem. I can't do the things I know I need to do in the moment I need to do them, right? So it's really important that parents understand it's neurologically based. Your kid or you are not trying to not follow through on certain things, right? And there are things that we can do to support the completion of things that need to get done. ADHD versus just executive functioning disorders. This might be, some kids don't go all the way to an ADHD diagnosis, right? But you might notice, oh, I definitely have, or they definitely have some glitches in their executive function. Go back to that table and say, oh, these are the 3 pieces, but maybe you need 5 to get the full diagnosis. It still helps you think about interventions that could be useful. ADHD is distinguished by expanded difficulties with impulse control, hyperactivity, which is only actually 25%. And most kids grow out of it by adolescence. So it's important not to just think of the 2nd grade boy in the back of the classroom that's running around and can't sit still. It doesn't look like that for the majority of ADHD clients. Difficulties with sustained attention and change states. It's really important. I've heard, a better definition. Joel Nigg does some beautiful work out of the University of Oregon. He said ADHD is truly a fundamental difficulty with self-regulation. And when we say that, all these other symptoms that aren't about paying attention in school or being able to start and finish a task, they make sense, right? I can't regulate my sleep-wake cycles. I can't regulate or modulate how intense my emotion should be. I can't move from feeling upset back to calm very easily. right? So all of these are an effort in self-regulation. Sensory, I can't tune out that tag on my shirt that's driving me nuts in order to pay attention to something else that's more important, right? So self-regulation. Okay. All right, so a few brain basics. I'm going to go really basic here. So I apologize. Some of you may have already heard some of this, which I think is fabulous. If you have, that means it's getting out there. I think a really profound researcher in neurobiology is Dr. Daniel Siegel, who does a lot of work on the whole brain child and looking at how relationships impact the way our neurology develops. And he came up with, in my opinion, a very brilliant way of describing when people flip out. It's like a great way to explain it. So I'm going to show you really the basics, and then we're going to use it to talk about how it informs which intervention we're going to do at which moment with ourselves, our spouse, our child. So we start with our hand. This is the hand brain model for some of you who may be familiar already. So I'm going to take my hand, I'm going to fold my thumb in like this, and then I'm going to curve my fingers over. And you can really see it looks like a brain, right? Here's my little brain. So if I'm looking at my little brain, and this is how I teach kids in my practice, what's happening to them in their brains, because I want them to be science-informed ADHD patients. My thumb knuckle right here represents my amygdala. This is the fire alarm in your brain that says something's wrong, get alert, pay attention, be ready to do something, whether that's fight or flee, right? This is very basic. My thumb represents the limbic system. To be basic, it's the feeling control center of your brain, where emotions and mood come from, the limbic system. Notice when I wrap my fingers around, that's the prefrontal cortex that we call the thinking part of your brain, the part that walks you through logically what's happening. So you can imagine a kiddo who has a really strong emotion, right? When they get a big hiccup from their limbic system, they flip their lid, right? Or we flip our lid, right? And what really is operating in that very intense emotional dysregulation is the limbic system, like an animal brain. And you've all interacted with one when you're like, it doesn't make sense. We're doling out consequences. We've grounded them till college, and nothing is stopping the like grizzly bear attack that is coming at us, or the total shutdown. Remember, this can look like Frozen. I'm in my bed, I'm not moving, I haven't moved for 4 hours. I can't. That's this brain too. It just looks different. So now, what does this have to do with ADHD? Well, there's a very specific part of our brain called the anterior cingulate cortex, which again, this is oversimplified, but for our purposes here, it's the brain bridge. It helps communication between the thinking brain and the feeling brain. If you have ADHD, this part of your brain is underwired. It's there, the neurons are there, the connectivity is there, but it's not very efficient. Think of it as the difference between having a country dirt road for messages to get down and a superhighway like 495, right? So when my brain is trying to say, calm down, you're going to get in trouble, don't say that, right? When I'm having a strong emotion, it's much easier for me if I have ADHD to flip my lid. And it's harder to hug back down and gain integration or control where the system is speaking to itself again, where the thinking part of your brain is like, it's going to be fine. You did okay on the last history test. You studied this long. Yeah, it was a lot of work, but you got through it and it's going to be okay, right? So knowing which brain you're talking to at any given moment is really helpful in terms of what interventions we're going to give when it comes to emotional regulation. All right, so we mentioned some of this. The limbic system is the emotional control center of your brain, and the cingulate cortex is involved in emotional self-control, more focused problem solving, error recognition, and adaptive responses. So being flexible and fluid in how I approach a problem. So now we're beginning to understand why, if I have ADHD, it's not just that I'm emotionally impulsive. It's that the signals in my brain between parts of my brain that can help me problem solve are not speaking with each other very well. So emotions run hotter and it takes me longer to soothe and to get myself back to a place where I'm integrated and I can use all those great parts of my brain, right? Again, it's not intelligence. It's a performance problem, not a knowledge problem, right? So you can have a spouse or yourself or a child be so great at talking you through, oh, and then I really understand that this is why I flipped out and I'm going to do this next time or whatever. And here comes the same problem again. And they're and there they are. And you're like, how do you not remember all the skills and everything we said we were going to do? Right? Like, it takes a lot of repetition and it takes a lot of calm in order, like, this brain cannot be rationalized with. This brain, we don't teach skills to. The thinking brain is offline. We don't do any of that with this part of the brain. All right, one other piece that's important to recognize is the orbital frontal cortex. This is the kind of the senior executive, if you will, of the prefrontal cortex and the social emotional brain, the social emotional part of the prefrontal cortex. It is involved in social adjustment, control of mood, effective responses, and events that are stored in implicit memory. Remember, we said that there's a lot of time blindness and a lot of short-term memory difficulty in ADHD, right? So I'm having a hard time utilizing social learning in a more effective way because it doesn't always get stored properly, right? Especially if I'm emotionally flooded. The orbital frontal cortex is extended. It's more impacted for ADHD people on the right hemisphere. It impacts both, but it's impacted more in the right hemisphere, which goes to how we're going to deal with the flipped lid, which is we're going to connect right brain to right brain. And we'll get into that, like how to calm when someone is emotionally dysregulated. Also involved in facial and vocal information. So again, you can understand if someone is really emotionally upset, they're not getting all the cues and information. So it just also can't be personal at that point. Even if it sounds personal, personally taking on whatever is coming at you from an animal brain is usually not helpful. And at least for me, it's very triggering. So I'm going to be less effective in my response if I'm really believing the stuff that your animal brain is saying in that moment. And I might ground you till college. All right. So what is an emotion? It's a short duration change. It really isn't that long unless we re-up it and keep going, right? It's a short duration change in arousal, alertness, and motivation, right? It's also how we communicate with each other that we need something or something's going on from one human to another. This is how we let each other know, right? So if I struggle to modulate my arousal, my alertness, and my motivation, my emotions are going to be a little bit all over the place, or that's going to be a very prominent part of how ADHD impacts me. All right. So the emotional qualities in executive functioning difficulties, or ADHD, are that they happen quicker, they are in fact stronger, and they last longer. Right? This is not anything you've done as a parent to cause that to happen, although we can be powerful instruments for shortening that duration, right? And to helping them not flood as quickly over time. This just happened. Quicker, stronger, longer, right? And when they're little, I call them super feelers, right? It's amazing. It also comes out more often in fight or flight, right? So anger and hostility is pretty common. Flight or freeze is another response. They also can perseverate or ruminate on something. This is the looping for a good half hour, hour. We're still talking about the same problem with low self-insight, and we're still going and we're still going. It's because they are taking triggers and extending that short active emotion And so our job eventually is to help them get off that ride, right? Like, and not, certainly not ride it with them, but perseveration is a part of ADHD. They can become rigid and lack flexible problem solving, as we know, because they have flipped their lid, and it's easier for them to do that. They also have difficulty with self-monitoring and taking perspective. When under threat, it's just important that they survive and not that you're a human that is particularly helpful to them at that moment, sometimes. Okay, so connections and relationships. The number one predictor of peer rejection is emotional volatility, right? Anger and aggression, obviously that one makes sense, but not being able to predict another child's emotion gets you cut off from friendship opportunities by about fourth grade, right? Because social relationships are built on predictability over time. I know how you're going to respond to me, and I know that there's some kind of pattern to it. And if some days you're wonderful and warm and other days you're flying off the handle, I might love you most of the time, but that volatility might cause me to not develop trust. And then eventually I'm kind of moving away, which then reinforces to this ADHD kiddo that they're not likable or that they're problematic, right? So it's a huge part of what will bring kids in for therapy, or adults for that matter. But the ability to maintain and explain in relationships, like when that emotional volatility is happening. Due to the difficulty with self-monitoring, they're often unaware of their impact on others. They're just not taking it in. They have this really awesome idea, and why wouldn't everybody want to listen to it? Like, Joe Schmo's idea for the project was terrible. Like, I don't have to listen to that. They're just moving on, right? So, and not recognizing that, okay, maybe they never want to be friends with Joe, but Mary is in the group too, and she didn't like how she saw you just treat Joe. So now maybe you're not invited to Mary's birthday party because you're not able to take other perspectives. So I'm not going to build trust or reach out in that way. Parents will describe, or partners of someone with ADHD will describe that they don't feel felt. And that's a weird thing to say, but if you've experienced it, you know exactly what that means. So someone might be talking at you, or when their brain is integrated, really emotionally attuned and present, but there's any stress or pressure on that brain and their executive functions are working harder at different things, it's a misattunement. People will say, I feel alone and I'm in the same room with you. I just don't feel like you get it, or you get me, or you know what I'm feeling or going through right now. Yeah. And the toughest part is it's not that they don't want to, and it's not that actually they're not capable some of the time. It's that it's inconsistent, right? Consistently inconsistent. And last is rejection sensitive dysphoria. This is a very extreme emotional sensitivity. It is more prevalent in ADHD. Not everyone with ADHD is going to experience this, but it's something as clinicians we really watch for. And anecdotally, it's what I will hear creates a lot of difficulty in marriages with people with ADHD who suffer from this part of it. Also with adolescents who are already dealing with difficulty with lower dopamine levels during adolescence, who are very emotionally sensitive at that time. Their limbic system is under construction. It's on fire, basically, and worried about self-harm or poor coping strategies or addictive behaviors happening. Rejection sensitive dysphoria can be a piece of this. So it's a very extreme emotional pain that is triggered by the perception. What's important here is it doesn't even have to be real. It can be that they perceive that they've been rejected, teased, or criticized by someone they deem important in their life. Not everybody, but some people. So parents, yes, absolutely. Even if they're rolling their eyes at you, you're important. So if you even approach that they're avoiding a math assignment, right? Like it can be really like, right? You get full fight or flight. Like they're ready to die on this hill. And you're like, what just happened? right? They may feel that you're rejecting them. You think they're less than, which they're already concerned about. And so they're responding as if you have just done something horrific when you just asked about something that's really sensitive for them. So RSD can be triggered by a sense of failure, falling short, failing to meet their own standards or others' expectations. One way we see it more often in girls is a more perfectionistic performance in overcoming ADHD symptoms. They will study for hours. They will not have room in their lives for social things after school. They will say no to other opportunities because they have this drive to get school done well. And for them to do that, it takes so much longer that they need all of these patterns and strategies that can look even OCD level, like rigid adherence to ways of approaching their homework so that they don't fail, right? Because there's something different about their brain. But this is a kid that sometimes wouldn't even get flagged by the school because they're getting A's. They're fine. It's not a problem. But behind the scenes, what they have to do to maintain that is so intense for them. They may feel that they might fail. So if you're challenging their perfectionism or trying to get them to relax, you get the RSD response, which is like full fight or flight, like full existential threat. An emotional response can be internalized or externalized, right? So I always say you're attacking outward or you're attacking inward. When I'm attacking outward, externalized, like instantaneous rage. I'm just flipping my lid. I'm flying off the handle. I'm being rude. I'm saying stuff that should never even be said, right? It's very impulsive, really rude, completely outrageous, right? If it's internalized, that self-attack can be just as intense, straight on to suicidal thinking. I don't even deserve to be here, right? So RSD can make people with ADHD anticipate rejection, right? Even when that's not necessarily certain, and it can make them vigilant and avoidant. Right? Again, not lazy, really fearful of failing. So a large part of treatment with ADHD is awesome fall, right? Which is I tried and I got a C minus. It was like, yes, excellent, right? Because you had been just getting Fs because you didn't turn anything in. Weren't even going to try it because then at least you could be in control of the fact that you got an F because you didn't even try, right? So engagement, activation, being willing to slip, fall, fail, keep growing is a huge part of overcoming parts of ADHD. Some of you may recognize that in your own experience, this rejection sensitive dysphoria. And there are certain medication profiles that seem to assist or support and help with RSD. All right, so many people will ask, what is the difference between ADHD-related emotional regulation difficulty and mood disorder? How do I know if it's anxiety and depression or ADHD? I would tend to say that emotional dysregulation and possible mood disorder is the norm, not the exception in ADHD. There's a lot of overlap, right? But to piece it apart, executive function emotion is provoked by the environment and it's situational. Basically, it makes sense. I have a history test and I'm avoiding it, and you told me to go study and I flipped out, right? It's rational, but it's just not inhibited. I had no breaks. The emotion was too big for the situation. I didn't calm down very quickly, but it makes sense in the context. It's immature, but it's not related to the limbic system disorder. It's more of a, I didn't have breaks on that emotional impulsivity. Mood disorders are not necessarily provoked by the external environment. They're internal. There's not always a reason why. I just don't feel good, or I just feel terrified and worried that the other shoe is going to drop all the time, right? So that is more of a limbic system involved problem. Again, it is common for ADHD clients to have both, to have anxiety and ADHD, to have depression and ADHD. So it's important to tease that apart. All right. So how do we help based on brain science? So parent self-care, regular self-care. If you are the patient with ADHD, you're a powerful, powerful instrument of growth for your child or for your partner. It takes a calm brain to help another brain grow, right? So you have to practice non-reactive support when there's emotional dysregulation, right? And again, that requires you to do a lot of self-care to remain calm when, here comes a flipped lid and it's 6 o'clock and you still have to cook dinner and you worked all day, right? Nobody's their best at that moment. And yet, when we react instead of respond, most of us recognize we just climb the ladder together. And then everyone's screaming and the whole house is dysregulated and it feels awful and nothing gets better, right? Because we are dealing with a flipped lid, and that's not a rational thing. Also remember, 35% of parents who have a child with ADHD have ADHD themselves. So many parents are recognizing after their child is diagnosed that, hey, I think maybe that applies to me in certain areas. So it's highly, highly heritable, right? So genetics play a really, really big part.
Nikki, if I can interrupt here for a second, is that when you say 35% of sets of parents?
Ah,
Is it, you have a 70% chance that one parent is going to have ADHD?
that's a good question. I've not heard 70%. So in this statistic, I'm thinking, but I have heard as high as 40% of one parent having ADHD. But
so 35% chance of one parent.
One parent having ADHD. Exactly. And what's kind of nice about that as a clinician, it's not always, exact, but if I have a parent whose child is diagnosed with ADHD and now they're like, oh gosh, I think this has been impacting me too. Like, I can take a look at that parent's level of functioning and have a pretty good predictor of how their kiddo is going to turn out, right? Because here you've been hanging on like all this time and you have a full-time job, you have a marriage, you have children, right? Like, so you've been very, very functional, but maybe certain parts of your life have been really tough or more difficult than they needed to be. So sometimes I remind parents, like, your kids, their brains are still developing. If they have ADHD, it's a neurodevelopmental delay, not, a disaster. So 15 to 30% delay in their development. Okay, they look 12, but definitely that 8-year-old is like responding to you right now, right? Just adjust. We get it. They're 12. They should be able to do this, but they can't. Neurologically, it's not available to them yet. So let's go back to how you would have a consequence or some kind of interaction for an 8-year-old. Let's just meet them there where they are, right? They will get there as long as we continue to go back and parent in a neurologically appropriate way. If that helps. Lots of parents are like, they're never going to go to college. And I'm like, well, yeah, that brain won't, but that brain is going to continue to grow quite a lot. So mindfulness-based interventions are showing a lot of efficacy in reducing symptoms of ADHD. So they help to moderate, right? They really go after the anterior cingulate, right? That's the part of the brain if someone's meditating or doing a mindfulness activity and you stick little electrodes on their brain. That's the part of their brain that's lighting up. That one that is coordinating between the limbic system and the thinking brain, right? And syncing up the default network and the task-oriented network, right? To put those in sync with each other. So any client that's part of my practice is prescribed, whether they do it or not is on them, some meditation or mindfulness activity. I don't care how you do it, but if you have ADHD, this is just like brushing your teeth. It's a no-brainer. If I can get 5 minutes a day, that's great. If you do it in a yoga format versus us totally sitting still and oming, like, I don't care how you do it, but we're going to do some kind of mindfulness-based slowing of the brain and interoceptive awareness of what my body feels like in space, because those are the parts of my brain I'm trying to get to think better, talk to each other better. And for me personally, I think it's always a great part of a holistic treatment plan for ADHD. So dealing with a flipped lid. All right, so we're going to go into self-calming activities for a flipped lid versus one you would use if you have an integrated brain. That's when the cool conversations can happen. Removing stimulus. Whatever is causing the flip out, it's sometimes nice to just take a pause. Remembering sometimes as a parent, that's my face. Just me being in the room is problematic at this moment. So if I can just take a pause myself, take a breath, do a self-calming activity for myself, and then come back. Remember, the executive functioning flip is situational. It makes sense, it's just too big. So if I can interrupt the stimulus response thing like this that's going on, then it typically dies down pretty quickly too. Lots of parents with a kid with ADHD will be like, I feel so emotionally hungover, and they're over there just like, what? Like they're back to dinner. They're fine. Like when the danger is over in their brain, they literally are back to just like, what's the problem? Everybody move on, right? People are wiped out and laying on the floor as parents. So removing the stimulus, including yourself, can be incredibly helpful. And then learning how to create a new emotional experience. So how do we do that? Brainstorming self-calming ideas. I'm going to skip this one just to get right to it. Here are ideas in different categories. Everybody's toolbox looks different. So you're going to have to do trial and error. And it may also be based on which areas of executive functioning impact your child or yourself the most. Lots of kids hate breathing. It feels like it's the only one people tell them to do. And they're like, I am breathing, right? Like, not particularly helpful for some kids, even though all of us know it works. They might not do it first, right? So stop asking them to breathe. If they start to integrate a little bit more, then you might suggest a breath, right? For a really big flip lid, you might ask them to move, right? So think I'm in fight or flight. What's helpful if I think I'm being attacked by a tiger? I should probably run. I might want to do 14 burpees, right? I want to throw something safe, like soft things that nobody cares about. Throw those. Put my feet up and my heart down. That will just slow the cardiac response to like, right? Like just put my feet up on my bed and lay on the floor while I'm telling everyone how horrible my parents are, right? Even just touching your own heart with one hand and the other hand on your belly. It's a safe stance. It just works. It just works. It's calming. So they can do that again, alone or private. So think about sensory wise, moving the body. Naming it to tame it. This is a little bit more cognitive. So again, they might not be ready for this one if we're still here really big. Some kids actually do like that. And they can have a mad journal or a journal where they write every awful thing they're trying not to say to your face, but they need to get it out, and no one ever gets to read the mad journal. Just get it out, right? That's fine, right? Then tear it up, throw it away, whatever you need to do. Talk to someone you trust, start naming the emotion, right? These again are going to be a little later in our calming activities because we're waiting for that prefrontal cortex to be a little bit more involved. Moving to interoception and body stuff is my go-to first. Then breathing, if they're willing to try that with me, then I'm going to move into naming from there. So senses, focus on silence. Stop talking. See what you hear. Kids with ADHD really appreciate visual stimulus. So I want them to name however many green things they can find in the room. Just start naming them. Now, how many circles can you see? Count them out. What I'm doing is I'm throwing a little lasso up to their thinking brain and I'm pulling it down over here because I'm getting a little bit of cognitive activity that's non-emotionally based. I have no emotional feelings about how many green things are in the room, but it takes my thinking brain to do it, right? Quick little math problem, 3 + 9. Right? Kids will look at me like, what? Right? Or someone's having a really big emotion in session. It's getting really, really intense. I'll be like, oh, What is your left big toe doing right now? What? Right? Introspection. But the looping, the perseverative, the suffering, because I can't get out of this spiral. When I tune the body, when I pay attention to my body and my senses, that is not where emotions live. That's where they're expressed, but that's not where they live. And all of a sudden, I feel like I've got my feet underneath me. I feel like I've got some grounding again. Smell your pillow, chew some gum, right? Especially if you're really hyperactive, like, and they're talking a lot. Like, gum can be wonderful in the car. I'm a big fan. The gum chewing, walking outside. It triggers every single sensory, right? You might not be consciously aware that there's a breeze, but your skin feels it. You're smelling that there's that new soil smell, like the decay from winter is there. And as it starts to heat up, you can smell that the soil is like getting ripe for the crocuses to come out or whatever. So our bodies sense these things. If we're just walking, even if we can't name it, go outside for 5 minutes to calm down. Then they might breathe. The calming sequence is nothing special at all, but I teach it to kids because they think that if they follow this, it will work, right? And so it's a little trick. There's nothing special about squeezing your fists or rubbing your foreheads over your eyes and then rubbing the tops of your thighs. It is simply a pattern and something they can follow that is sensory and appeals to their brain. They're like, did I rub my eyebrows 4 times? Okay, 1, 2, 3, 4, rub my thighs. Okay, I'm rubbing them, and do this 5 times, right? Don't tell them that it's not actually special, but it's not. The same way it doesn't matter if you do 4, 7, 8 breathing or 5, 5, 5 breathing. It doesn't matter. It does actually help to exhale longer than you inhale. That part is actually helpful. But whatever helps in that moment. We're in crisis, right? So we don't have to be perfect. We just have to be working towards calm. All right. I really like self-regulation apps. I think they're wonderful for adults and teens. Headspace, Calm for younger kids. The zones of regulation is great. They put it in like red, orange, yellow, or no, sorry, red, yellow, green, and blue. Makes it really simple to understand where you are and to come up with different tips you're going to do for yourself to get from like blue is like, I'm sick, I'm tired, I'm frozen, I'm laying in my bed. And sometimes one of your activities is I'm going to stand up and put my feet on the floor. And if I have extra energy, I'm talking about a depressed client, if I have extra energy, I'm going to put my face out the window so actual sunlight hits my eyeballs, right? I'm just going to do that for 5 minutes. That might be one of their tips that they're doing to move from a blue zone to a green zone. Red zone is more activated, like the flip lid screaming, yelling at you. That looks different. ACT or acceptance and commitment therapy is just has some really wonderful regulation. They have an ACT companion app. DBT is a skill that I'm trained in. I use dialectical behavioral therapy to help clients work on mindfulness, distress tolerance, emotional regulation, and the 4th module is interpersonal effectiveness, like how to help your peers feel more felt by you and how to use emotional regulation to impact your relationships positively. Let your child or spouse do the work. Many parents work harder at emotional regulation than their child does. Redirect them to their self-calming list. Say, hey, this looks really big. I'm going to step out. Like, let's pause. It's getting too hot. Like, this one's really big, right? Grab your list. That's why making it visual, printing it out, having it in places because they'll tear it up and throw it at you at least once. So have extras, right? Like, be ready to go. And then afterwards, just ask what worked or what needs to be revised or what they noticed. They thought they would love this journaling activity, but they hate it, right? And then when inevitably they start to calm a little bit, right? If I go from screaming to crying, that is activation of my calming nervous system. That's a good sign. When you hear tears, when you feel tears, like, you may approach. right? That is a safer zone, and just be like, you're doing so good. Now I can praise your regulation, not that you flipped out. We might not get to controlling flip out for a long time. So I better shift my praise and my attention to effort and persistence with self-regulating. Takes a really long time to learn. It's not just a special technique. It's 15 of them tried multiple times with one calm brain helping another calm brain. That makes sense. Have a growth mindset towards emotional regulation. There are no fancy, quick ways to do it. There just aren't, or you guys all would have figured it out by now. You wouldn't be online late at night listening to me, right? It's not easy. It takes a lot of persistence and focus on effort, right? If you're a kid, I've had a kid in session, throw something near me, right? Like pick it up and be like just whip it near me. They completely could have connected, could have hit me right in the face with it. They did not. And I said, thank you. Like, you are so angry at me right now, and you could have hurt me, but you didn't. I feel safe with you. What can we do to understand what you're so mad about? Now, of course, I'm in session, so I'm like in that zone, right? If I'm at home, I don't know that I'd be that calm. But the idea there is, if I can't recognize any little amount of effort toward emotional regulation, I'm never going to get the full thing, or it's going to take us a lot longer to get there. Remember, if I feel like I'm being rejected, criticized, I'm less than, I suck, somebody noticing a small effort toward emotional regulation makes a big, big difference in motivating me to keep doing it, to keep trying. Okay, I think these are pretty self-explanatory, like how to give a command. The only one here that parents might not have heard, like, again, you're going to try to use a neutral tone. You're going to try to offer choices when you can, is the deliver and move one. I love this. This is like parenting or telling your spouse something by sticky note, remembering your face and potential perceived, like you might not even be allowed to roll your eyes without triggering emotional sensitivity, right? So write it on a sticky note, slap it down and move, right? Get out of the way to give them extended time to think about what you said, to comply, right? This might be like, time to start homework, boop, and then just get out, run, because they might just need a moment to be like, ugh, right? And then you're not there for it. It's not coming at you. And eventually they might, move on to doing their homework. And now you're like, great job. Thanks for doing that. Right. So don't be afraid to use sticky notes and move. All right. So let's talk about medications. How am I doing? Let's talk about medications. Just a couple categories. Again, I highly recommend, sorry, I keep hitting the thing. Working with your physician and your psychiatrist, right? But so that you understand, there are 3 sort of categories that we're using currently to support clients with ADHD. There's the stimulant categories, right? Which work by increasing a higher amount of dopamine at a faster rate, so it's available to the brain. The categories of these drugs are methylphenidate and amphetamine-based or Adderall. And really the only differences in the stimulant category are how long they last, how they're being released in your system, right? So it's the same category of drug, it's just the delivery system that's being worked on here. Stimulants are pretty much the gold standard if there's a high level of impulsivity involved in ADHD. Stimulants really do tend to work well. However, 30% of clients don't respond to stimulants, right? So we need to have other options. Non-stimulant medications are SNRIs, serotonin norepinephrine reuptake inhibitors, right? So they slow down and inhibit the neurotransmitter absorption. So they don't create more neurotransmitter. They slow down its absorption so it's available in your system a little bit longer. This category, we have Strattera, which is anecdotally, a lot of people find great relief for anxiety or depression, not so much for the ADHD part of the symptoms. Qelbree is a newer one. It's been used in Europe for a while. It was approved last year in the United States. And anecdotally, again, some clients, especially adult clients, are finding that this one is working well for them, especially if they didn't like the revved up feeling of stimulants. Stimulants are tough because they're highly effective when they're in your system, but they're either in or they're not. And most of your day, you don't need to be on, right? So it's, also you shouldn't feel your stimulant if your child is on a stimulant and they say, I don't really think it's doing anything, but they haven't been in timeout for a week. It's working, right? Like we don't want them to feel that it's there. That's too high. That's too much, right? But you will notice overall less impulsive acting out, better emotional regulation, those types of things. The last are the antihypertensives, which really are an alpha 2 agonist. They help plump up the prefrontal cortex. So they're working top down on ADHD, going after the executive functioning piece. These are clonidine and guanfacine, or Intuniv. Those are the major categories of medication for ADHD that we're utilizing at this time. So medication mechanism, amplification of the signal. Dopamine will increase the signal strength in the prefrontal cortex to kind of overcome the noise, right? Like it shoots that up. Norepinephrine will increase the saliency of the one you're paying attention to and decrease noise from external stimuli, right? Both are important and play an important role in stimulant and non-stimulant medications. So for emotional dysregulation specifically, stimulants will suppress the limbic system. They will have a suppressing effect. So some clients will report or experience emotional blunting. They just feel flat. This is not necessary. They're probably on too high a dose and isn't something that should be tolerated. We don't want them to lose their joie de vivre, right? Like just so they can sit still in class like a robot. Like I would call that non-acceptable in my world. So if you're seeing a ton of emotional blunting, we're on the wrong stimulant, it's being like released in the wrong way, or it's a too high a dose potentially. Non-stimulants will again activate the executive system, the anterior cingulate and the frontal lobe. They're not always as effective at helping with some areas of focus, and especially with impulse control, they're not totally great there. Antihypertensives, this is the one that if you are really struggling with fast emotional flooding and rejection sensitive dysphoria, guanfacine has been shown to do some really lovely things in that category, even for adult clients, but especially for kids. Qelbree, again, this is anecdotal because we're still having newer research here, is also helping with emotional regulation. So emotional dysregulation specifically, how those meds work. All right. If you only take away 3 things, self-calming, we can grow our brains. So practice often and celebrate your effort, right? Your relationship with your child or your spouse or yourself is that change agent. Take care of yourself. Sleep, eat, right? It's already hard for your brain to integrate. We can't always know what reaction our child will have, but we can choose our responses whenever possible. All right, that's it. Sorry. It took a while.
Fantastic. Yeah, it took a while.
Trying
That's
to
okay.
get to like question time. Yeah.
Yeah. So, but thank you so much. That was fantastic. There was a lot of great visuals and great anecdotes and really good information there. I think that was absolutely terrific. Just a couple of points, if I could, because you're focusing more on the kids, but
Yes.
I deal more with the adults. And you were saying this from the kid standpoint.
Yes.
We always taught in medical school. We had talked about this before that you don't want to treat kids like little adults. But one thing I've learned after 20 years of medicine is that in many, many ways, adults really are just big kids. And so a lot of these same things really apply to adults. It just may look a little different. We flip our lids too. We get stressed.
Totally.
All these different things, everything that you put on that first slide. Yep. I think, everybody has dealt with at some point in your life when you're stressed, when you're tired, when
absolutely
it just gets to be too much. I mean, and so we all have traits of this. It's so we becomes ADD, the last D I would say is the disorder. It's when it's
Yes.
always there and
Yep.
impairing your ability to function. But
Yep.
everybody has some traits of ADD.
Yep.
So
Very good point. Yep.
and then, so what, another thing you just said it at the last minute there about the sleep. The other thing that I
Mm.
obviously is, that, people often say you can sleep when you're dead. I'm a big proponent in sleep. And a lot of times we didn't go into the diagnosis of ADD, but one of the things is that the diagnosis of exclusion, you need to make sure that you're rolling
Have a
out
sleep disorder.
causing it, right? And so
Yeah.
sleep disorder, inadequate sleep, insomnia, whatever it is
It's
impaired.
also comorbid. So many clients with ADHD have a sleeping difficulty. Again, it's that change state difficulty. So you're right, like a huge impact on ADHD symptoms can be a proper sleep habit,
Right?
right?
And it
Like
feeds on
let's
itself, and then it becomes
modulate.
a
Exactly.
self-fulfilling cycle
Yep.
too, or too much medication, which is then preventing
Yes.
sleeping. So yeah, so
Yes.
there's a
Yeah. They take it too late. Yes.
right, yeah,
Yes.
huge part of that.
Yep.
And so yeah, so and so. But I think that was just fabulous talk. Yeah, we. The other thing is there are the meds that you mentioned too. There's a few other ones that we use also that are
Hmm.
more off label, like but
Got you.
along the same lines too.
Yep.
But
Yeah.
there's a lot of options. So the questions a couple people put
Yeah.
down. First of all, one person asked, should a 70-year-old start an ADHD med?
What
And
was the question? I missed the
the
first part.
question
Sorry.
is, should a 70-year-old
Oh,
start an ADHD med?
yes.
And I'll leave that up to you, or I'd be happy to
Please, I mean,
jump.
take it away as the med. I say yes.
That's beyond your normal bailiwick. Yeah. So
Right.
the first thing I would say to you is that, one, you want to make sure that you have the correct diagnosis. Like I said, ADHD is a diagnosis of exclusion, and to have the first diagnosis at 70 makes it a little questionable as to whether that's
Mhm.
really the problem. More often, it's a sleep disorder, it's another medication, it's
Mhm.
depression or anxiety or alcohol or something else that's masquerading as ADHD. And there's
Mhm.
many things that can give you those kinds of symptoms without it actually being ADHD. So the first thing you want to do is make sure that that's what you're dealing with. There's ways to go about that. And then the other thing is that starting on an ADHD med at
Cardiac.
70, there's, the kids, it's not really a problem, but, these stimulants can increase your blood pressure, they can increase your heart rate, they can
Mhm.
affect your sleep. They have their own list of problems. And so you don't want to do it willy nilly. If
Right.
you really need it and it's impairing your function,
Mhm.
then it's something to consider. And there are alternatives that you can use as well. But, you don't want to use it haphazardly. You want to use it with caution. So it's something I would just tell you
Yeah.
to talk to your
Yeah.
doctor.
Or potentially not the stimulant category,
Or
right?
no,
Like there's
right, right.
another
The
piece,
other
but more
option.
often it's sleep involved at that point. So we might be doing light therapy and melatonin and things like that to.
Kinds of things, right? Exactly.
Mhm.
The next question is that says, I'm in my early 50s and have been on SSRIs for
Mhm.
PTSD and OCD and anxiety and depression for years. Those
Mhm.
meds haven't helped much. I do have ADHD symptoms despite never having gotten a full diagnosis. Is there a
Mhm.
medication you might start that ideally won't make the anxieties worse?
Mm.
And is there a psychiatrist in Northern Virginia that's taking new clients? There are psychiatrists. Taking new clients is a little trickier. But,
Right. Yeah. Well, between Dr. Zweig and myself, we could probably help like knock some doors of some favorites potentially, right? I mean, your wait still might be 4 months, but um I don't even feel qualified to make a more informed choice in terms of medication. But what I would say is that there are many alternative treatments. First, I really like what you said about having a proper diagnosis. So if you have access to and or can do a full neuropsych evaluation, I think that's an incredible step to take. You can sign up at George Mason University. Their master level and doctoral level students do reduced fee. And they do really great reports because they're under wonderful supervision. So it takes a while to get in, but if that's a concern, but having a full diagnostic workup that takes into consideration not only executive function or the ADHD piece, but because there's trauma, right? And there's anxiety and depression. We want to know how all of those are working together before we make any recommendation on medication. But it sounds like you have not reached what you feel satisfied with in terms of relief of symptoms. So keep going, keep asking about alternative treatments like transcranial magnetic stimulation, TMS, be looking at alternative ways of approaching the trauma treatment. SSRIs don't work for everybody, right? They really don't. So I would say keep asking for more information and get a full workup. I don't know if you'd add anything else, Ken.
Yeah, the only other thing I would add is that the SSRIs are typically don't work in everybody, obviously, but they are typically good for anxiety and depression and a lot of these things. But if they don't work, and you're having some ADHD symptoms that's not being treated by these, then one, the ADHD component can be adding to these other problems that you're having. And so that may be, without addressing that, that may not be helping. And SSRIs typically don't really do much for ADHD. But there's another class of drugs called SNRIs, of which the Strattera and
Qelbree.
The Qelbree are part of, but there's also Effexor, Cymbalta.
Yes.
That as well. They're off-label for ADHD, but can help with anxiety, depression, and give you some ADHD benefits as well. Not quite the same.
Well, Butrin is also wonderful for midlife, like depressive symptoms and needing a little activation, motivation piece, like for that part of ADHD. Yeah.
And though it can sometimes worsen anxiety because it can be a little stimulating, but if your anxiety is from the ADHD and has that, then your anxiety gets better. And so it's really a trial and error thing, and there's a lot of different ways to go about it. And so certainly it's a very reasonable option. So.
Yes.
And then this next one was just a comment that that paradoxically stimulants can calm people down with ADHD.
Right.
I've always thought about that. I think there's part of it is keeping yourself the super highway, trying to make sure it's just getting the traffic moving.
Yeah.
And that's part of how it works, is getting your brain to function more normally.
Yep. Feels better. It's all synced up. Yeah.
It says, what effect does the use of marijuana have on a teenage ADHD mind?
I know. This one's so tricky. Okay. So, all right. For some kids, it really does, for them, hit that sweet spot of, like, if they have ADHD kind of anxiety combo, right? Like, and alcohol's too depressant, plus the morning after they get really, really anxious, like they have a cortisol spike and they didn't sleep well. So they move into pot, and it helps them to focus while staying calm. So they're like, oh my gosh, this is brilliant. But it completely wipes out their short-term memory. And so they literally become boo-boos. Like, it's just so boo-boos. It's so bad. It's just so awful for the teenage brain to be exposed to too much of this. You have to remember their prefrontal cortex is under construction from about 16 to 26, right? Like, from this large second dozen years of life is adolescence. And that is when the thinking brain is under construction. So if I'm utilizing substances that slow down that portion of my brain, like, we can see upwards of 15, 30 point drop in IQ from very intensive, regular daily use of marijuana, right? So I just say, I get it. I can validate that you're actually right, especially if your SSRI hasn't felt like it's working exactly how you'd love it to, anxiety-wise. And you're already on these other drugs, right? And you're trying to find what works. I get the feeling you're describing, and I believe you. And here are the other side effects that go along with that. So can we continue to work on alternatives, right? It's tricky. It's such a hard one.
Right. And if you use it regularly, you get that amotivational syndrome with kids that are already not getting the work done. And now you're taking away their motivation to.
Right. And then they feel calm about it. Like it's a terrible soup, right? They're like, I'm good.
Definitely
I
doesn't.
really am good with this. Yeah.
And here's the last question: is that my son, I guess he's saying that he has ADHD, has a tendency to use YouTube videos and other bottomless scan entertainments ad nauseum. Could this be related to ADHD?
Yeah.
Because taken away from him will always prompt the mad gorilla.
Yes. Yeah, I know that makes sense. So it's just a dopamine hit, right? It works on all of us, right? So that fast switching, the next video, the next video, the next thing, right? So because your son has ADHD, he has a lower level of dopamine available to him. So he is probably seeking simple carbohydrates, like jumping off of high things to get a big feeling, right? And lots of YouTube videos. Absolutely, that's related. And just like when you take crack from an addict, they don't like it and they go into withdrawal and they have an emotion about it, we still have to take it away. Like, absolutely. The ADHD brain is much more likely to become addicted to screen time than the non-ADHD brain because of that dopamine. It's trying to get it, right? So yeah, and it's an awful struggle, right? It's an awful struggle, but one worth battling until they don't live with you anymore. I mean, fight the good fight while their brain is developing, right? It's worth
Right.
it. Yeah.
Just don't ground them until college. But
And also don't react to that initial withdrawal, right? They're going to be a jerk, right? Don't respond. Anticipate that as the separation from the YouTube moment. And if 5 minutes later they've calmed down, just say, hey, it only took 5 minutes. It will shift the relationship. It will shift the relationship over time because they are going to blow it up if we allow them to, because he might not be able to control that first 5 minutes, that reaction.
yeah, great.
Another suggestion. Yeah.
I think
Not that that's fun.
right? No, it's not. But anybody who's a parent, I think, whether they have ADHD or not, has been in this situation at some point. Even if the kids younger time, they all go through it. So I think,
right.
I wish you had this talk, about 8 or 9 years ago, right?
Right. Yeah.
Well, thank you so much. That was fantastic. We're a little bit over time, but that's
Yeah.
because this was so much information here, and this was really a fabulous presentation.
Yeah.
A lot of good, helpful information. For any of you who are still on, we will be we have been taping this, and we will be putting a version of this on our website. So if you want to go back and
Please feel free to share my contact information as well. If people have follow-up questions or they'd like a parent consultation, which I will do, often, or seeking more information, I'm more than happy to get back with people.
What's the best way to get a hold of you?
Email is the best way. Yeah.
I'll put that in the chat.
Yeah, it's on that first slide. Let me see if I can get back to it. There we go. Yeah, so Nicole at McLeanPsychotherapy.com.
Send button is gone. Uh-oh. I'm not technically savvy here.
That's okay. No, I've got it up now.
All right. I think I put it in there. We'll see if it went. It made it. All right, good.
Awesome.
It's out there, and it's in the webinar chat now. Right? So, all right. Well, thank you so much. That was a great presentation. And please reach out to her if you need her assistance, or you can also reach out to our practice as well, and we can get you her information if you need to. And hope that was as enlightening for all of you as it was for me.
Wonderful.
You all have a great night, and thank you so much again.
Thanks for having me.
Take care.
Bye.